Hi, I'm Dr. Linda Girgis. I'm a family doctor in South River, New Jersey. I see patients of all ages, from infants up to the elderly. And this time of year, we're seeing a lot of kids for back to school physicals and vaccinations. Usually, kids entering kindergarten are due for boosters, and then we usually give boosters before they enter sixth grade. There's a lot of confusion around vaccines. There's a lot of people out there spreading myths about vaccines, and some parents are choosing not to vaccinate their children because they believe some of these myths that are going around. And I feel vaccines are very important, so I wanted to spend some time today talking about these myths. One of the myths is that vaccines cause autism, and this was the result of a study several years ago that was published in Lancet. Since that time, the researcher who published that article, he was found that he altered some of the data, and this study was refuted, and he's been pretty much ostracized by the scientific community. There are now many studies that show that vaccines do not, in fact, cause autism, and that this is false. There are many people who will claim that the mercury preservatives in the vaccine are what causes the autism and that it's dangerous. Today, most vaccines do not contain mercury or do not contain these preservatives, so the fact that we're still seeing autism signifies that it's probably not vaccine related. If we look at the mercury that was previously found in vaccines, it was ethyl mercury, which was not the type that was proven to be neurotoxic. The neurotoxic type was methyl mercury, which is the kind that's found in the environment. If you were to eat a tuna fish sandwich, you probably would have eaten more mercury than was found in vaccines. The vaccines are safe. We're seeing high rates of autism, but we are looking more closely at it. Teachers in school are now more aware of autism. We have more standardized tests to screen for autism. So the fact that we are seeing higher rates of autism is more likely due to the fact that we are better at diagnosing it rather than due to vaccines. Another myth that people are saying is that there's a government conspiracy to vaccinate people. People protest that vaccines are mandatory, and there's all kinds of government conspiracies, but the people who say that theory, they fail to look at the World Health Organization, UNICEF, and the fact that vaccines are recommended all over the world, not just in the United States. So the efficacy of vaccines cannot be just attributed to a conspiracy from the CDC and the government. It's been shown to be effective the whole world over, and I don't think a government conspiracy would make sense. It's hard enough to get two countries to agree about anything, yet alone to have this massive worldwide conspiracy to vaccinate children with unsafe vaccines. Another fallacy that people are saying is that we're spending all this effort to vaccinate children against diseases that are just part of normal childhood and they don't cause any long-term consequences. In fact, in the last century, millions of people died from these diseases. We've seen the elimination of smallpox throughout the world because of the vaccines. We've eliminated polio in the Western Hemisphere because of vaccines. Measles, people are claiming that MMR causes autism, and measles is not such a devastating disease, but out of every 10,000 children who contract measles, 2 or 3 of them will die. While this does not seem to be a very overwhelming number, if that 2 or 3 children were your child, that would be devastating. Also, with measles, people develop encephalitis, people develop pneumonia, people have long-term cognitive deficits from measles. So these are not benign diseases by any chance. There are some people who claim that the number of vaccines children receive are overwhelming to the child's immune system. If you think about the baby, when the baby's in the mother's womb, this is a sterile environment. So the baby's completely protected with the mother's antibodies, but at the moment of birth, they're suddenly exposed to millions of pathogens and all kinds of microbes, but their body has the defenses to fight it off. In comparison, vaccines represent only about 56 antigens that the child is being exposed to. On a daily basis, the child is exposed to millions. People claim that children develop immune diseases later in life because of vaccines, but we're really not seeing this. There's a lot of factors going on in our society. There's a rising rate of obesity, a lot of lifestyle factors. People are becoming more sedentary, eating worse. There are a lot of factors to contribute the rise that we're seeing of certain diseases. We're not seeing them so much in other countries, despite the fact that vaccines are being given all over the world. Another myth people are saying is that there's a conspiracy between pharmaceutical companies and doctors just to make money from vaccines. I can't speak for the pharmaceutical companies, but as a doctor in private practice, I know how much vaccines cost, and we barely break even given vaccines. I know people may not trust this coming from a doctor, but every time you go to the doctor, you will receive what's called an EOB, or an explanation of benefits from your insurance company. This will show you exactly how much your doctor has paid for the vaccine. And if you search the cost to how much it would cost to purchase it, you can see that it's the truth, that vaccines are not really a money-making item. People are barely breaking even with it. There's another myth that was going around that all these infectious diseases can be cured with certain homeopathic remedies such as colloid silver. I've looked at some of these studies, and these studies are looking at case studies of 12 patients, and you cannot make any kind of conclusion from such a small case study. When we look at vaccines, we have the science of millions and millions of people all over the world in all kinds of communities, in poor communities and rich communities, across all socioeconomic statuses, and they work in all of these people. So vaccines have been proven effective. They are safe. I know some people will say there's the vaccine registry if there are complications. There's nothing that's going to always be 100% safe with no complications, but complications are very rare, and they happen 1 in millions of patients to receive vaccines. So I invite everybody to do more research before accepting what celebrities say. There are people selling books about this. Read all the information you can. Use your minds and think about all the evidence and science that's out there.